So good afternoon everyone. Today we are seeing about geriatric 9 and 10 unit. This is will cover for your possession and comfort devices. Then we are have fault resection. Then we have transport of the patient to one place to another patient. So all the syllabus here will cover. So this is all the syllabus. May just reading about what are the procedure, what is the uses, what time we are using that portion. That's enough. Okay, so first question, we are using that portion. So that portion means we are planning the person to proper body element of the purpose to prevent or promote and curity and reliability to the health or placing the patient of good body alignment therapeutic we are using. So mainly we have that body element we are using that one. So what are the purpose we have? So promote comfort for the patient, relieve the pressure also various spot, then we have stimulate circulation also, proper circulation, then have proper body alignment, then have the out nursing intervention, then any surgical medical intervention also, then any complication of the immobility also, then we have physiological function also we can see it. Then we go for that what are the principle we have. So first maintain the good postures, then we can wash the hands before and after procedures. So ensure the patient comfort, then we have any assistance if you require, you can keep it. Then we have need for any mattress or a level of bed also we can keep near only. Then safety measure is important. Then we have systematic order which is important. Then what are the technique we are using, that is also we can see it. Okay, so mainly we have what are the superimposition, what are the part will be touched. Head, shoulder, elbow, buttocks and heel and toes. So in the supine position, mainly back of the head it will be placing. So usual position to while sleeping any position we can use it. Then then we are going for the if you are keeping that any examination of the chest or stomach also we can use that this supine position. So that time we have headboard or bed or airbag and all we can use it in supine position. Then prone position. So prone position maybe your abdomen will be turned to the turned into the bed. Then we can keep some pillow under the angle side we can keep it. So mainly we this one we can do in post-operative time we can do it. So any burns or injury anything happen we can give in. So sometimes you have if you are a prone position you will get abdomen distance will also relief. So that time any biopsy or any renal examination and all, we can do with that. Okay. So before doing anything, we should always explain what are the position we are changing. We can keep all these curtains to privacy of the patient. So then adequate comfort devices also we can provide. Then lateral position. So lateral position means we can have that side lateral or right lateral, both position we can do it. So and it means if you have leg means it will should be upper flexed and your abdomen will be lower leg flexed. So mainly we have that any supportive we can give for the arms and abdomen, and to the pillow knees and all we can give the comfort devices. So mainly have that pediatric position change will be there. In post-operative we can do it. Then perineum examination or inserting any suppositories or rectal temperature same time and all we can any back care and all we can do it this one. And then lithotomy. So lithotomy position always we can use for the any pap smear examination or delivery. Then we have that vaginal inspection under we can do it this one for the lithotomy position. Then we can go for the dorsal recurrent position. So mainly we have back, knees and full flexible thighs at all. It will be flexible with there. So usually we any catheter. So any catheter or injection and all we can tampons and all we can use for the dorsal recurrent position. Then we can go for the Fowler position. So Fowler position means 45 to 60 degree we can keep. Then we can go for the populated vessels and all, avoiding to the pressure and all we can give it here. Then we can have 30 degree, 45 degree and 90 degree. So comfort devices we can give that one. Then we can go for the Sims position. Sims position we have that posterior view. So in the posterior view we have any vaginal rectal examination or enema suppository or any anal rectal exercise and all, signoscopy, proctoscopy and all. Sims position we can do it. Then we can have the trundle back position. So mainly we have this for any emergency, any hypertension, any ICP level, then have any deep vein thrombosis or any IVF. That time and all we can use this one. This position we can give. So always your head will be down, your limb will be upper. We can use these positions. Then we can go for the knee chest position. So knee chest position mostly 90 degree of the hip back to the side. So above the head is the turn to the one side only. We can keep. So mainly we have any vaginal rectal examination or any cord prolapse or any postpartum exercise and all, we can do it here, this type. Then orthopedic position. So orthopedic patient mainly we have any severe dyspnea or cardiac patient or thoracentesis patient or any drainage tubes and all will be there means thoracic posture we can give it. So patient can able to sit and do all the activities. Then what are the devices we can use while giving the position? Pillows, backrest, then we have head rolls, foot rest and knee rest and sandbags. So here are water matters we can give. So here we have, can give for the cotton ring, bed cradles, bed block, hair cushions, cardiac table, side raise and all we can give it here. Then mainly we have the body movements. We have that flexion, extension, abduction, adduction, protraction, retraction, elevation, depression, lateral rotation, medial rotation and pronation, then supination, then deviations, so opposition, repulsion, invasions. So usually we have that opposition when bring the thumb contact finger, then repulsion means separating the thumb from the digit, then we have the inversion means plan side toward to the medial plan. So we can have that all the exercise we have that human body. So we are doing all the works and all here. Then we are go for that method of transporting to the patient. So we have that first prepare the patient. We can pull to the edge of the bed. Then we can keep for stand it. Then we can place. We can slowly turn it. Then we can place the patients. So we have that. We can follow any stretcher or any bed. We can do it that. First, you can always inform to the patient. We can take for the privacy of the patient. We can inform to the patient to what are the procedure you are doing, then keep the patient edge of the bed. We can we can tell them that time patient if you can able to stand means we can hold it and we can turn it and we can keep the patient in so we in the wheelchair or stretcher anything, then the side raise or anything, foot rub means everything we can use it. Then we can go for that next for the transportation of the wheelchair. So this is the how that manage lifting and keep placing to the one place we can see it. Then we can go for that next patient have any first how to sit the patient properly. So always patient we can keep for the middle of the bed we can keep it, because we should not keep for the edge of the bed because fall precaution will take. Then we can keep, then we can hold it, then we can place the patients. Then we can go for the what the body mechanism we have that. So we have that balance spine we have that. So we have the we have the vertebra, the three vertebral cortex is arranged to the three natural curves. So we have no we have that cervical curves support to the head. So we can give the thoracic curve also we can give it here. So then we can have any lumbar care also we can support it. Then we can keep the other patient in the bed. Then we have that any check. Then we have that any minimize weight or any minimize mold also we can hold it and we can do it. Then we can have any prevent for twisting sharing or disco form and all we can do it for that there only. Then we can have that any work order, so quick jerk movements, that movements and all we should avoid it. Then we can go for that and we can go for that principles of body mechanism. Mainly in the law of the government we can general have the principles that have that person have center of gravity and basic of basis of support. So in the basis of support we can have that all the kind of doing the any position we need that patient gravities and patient support is the main important thing. Then we go for the standard for fall in a fall precaution. This is the 5 more questions. So fall precaution usually use the call light to whenever you are need help. We can advise to the patient side. Then if you're nursing to help from any bathrooms or anything also, we should always keep the light is wall in wall. Then we can have any safety or any member of star nursing staff may can stay into the bathroom and all. We can explain it. Then we have take any medication causes means that is medication causes also bathroom go to the bathrooms after. We can help to get up and we can consider to the comfortable or urine we can advise. So we can always no sleep pro footwear should be wear. Then we can have any eyes glass also we can wear. Then walkers. Then we have any comfort devices and all we can provide it. And we can have that any lights or phone personal phones, any item also we should avoid to keep there in washrooms. Then what are the fall precaution we can take? So usually the fall precautions are the imbalanced to the organization. So we have the patients have risk to all the stages. So first we can identify the vulnerability of the patients in the group. So we should always discuss about which documentation or communication is the main important to the patient life to risk. So then we have that any process or responding means immediately we can standardize the information and investigate it. Then we can audit process we can do it. So all time we can have patient clinical notes including asking
अच्युतं केशवं कृष्णदामोदरं